Hello, everyone. My name is Sarah Scanlon, and I am the NEARS coordinator for the Wisconsin Department of Agriculture, Trade, and Consumer Protection. Today's presentation will review the data collected by sanitarians during environmental assessments after outbreaks occurred at retail establishments, share the determined causes of those outbreaks, and propose considerations for improving foodborne illness prevention. Joining me in presenting today will be the DATCP Advanced Sanitarians, Alex Hintz, Jenna Oradnik, and Wahaj Syed. DATCP's mission and vision include: our mission is that we partner with all of the citizens of Wisconsin to grow the economy by promoting quality food, healthy plants and animals, sound use of land and water resources, and a fair marketplace. As our vision, we will deliver efficient and effective programs and services to Wisconsin agriculture, consumers, and businesses to provide market confidence and to enhance competitiveness and profitability. Our core values include diversity, accountability, teamwork, customer service, and professionalism. I will hand it off to Alex on the next slide.
This is the National Environmental Assessment Reporting System, in which environmental health specialists perform environmental assessments to collect data during foodborne illness outbreak investigations that are associated with retail food facilities. An environmental assessment is where a sanitarian visits a retail establishment during an outbreak investigation and reviews their policies and observes their processes through the lens of the illness agent. The information collected helps specialists to determine contributing factors and environmental antecedents. Contributing factors are how the outbreak occurred, whereas the environmental antecedents are the underlying cause of the outbreak or why the outbreak occurred. When the contributing factors and environmental antecedents are identified in an investigation, that allows the sanitarian to provide recommendations to the facility involved in an outbreak to assist them in preventing future outbreaks at their establishment. The information collected is entered into the Center for Disease Control and Prevention database, where that information is used to prevent future outbreaks, influence future food code, and observe trends in outbreaks. Wisconsin had 11 outbreaks which were determined to be foodborne in 2024. Each county listed having one outbreak in their jurisdiction. The stars on the image of Wisconsin indicate where each of the outbreaks occurred. Like 2022 and 2023, norovirus was the leading agent responsible for foodborne illness in Wisconsin during the 2024 year, causing 73% of all reported foodborne outbreaks. Salmonella came in second, responsible for 18% of the reported foodborne outbreaks. One of the outbreak agents could not be determined in 2024. Response time is recorded for environmental assessments, as the further into the investigation, the more likely it is that a food facility may change its practices once being notified of an outbreak. If practices are changed, it makes determining the contributing factors more difficult. CDC recommends that environmental assessments occur within 24 hours of a facility being identified for assessment. In 2024, environmental health was in contact with the facility within 1 day of outbreak notification 45% of the time. The average response time between initial identification of the outbreak and the NEARS observations was 2.8 days, which is an improvement from 2023, where the average was 3.5 days. Outbreaks occurred in 4 different categories this year: restaurant, school food service, caterer, and shared kitchen base, which was linked with a mobile restaurant. 8 out of the 11 establishments were independently run, while the remaining 3 were chain establishments. Now I'll pass it off to Jenna.
Hygiene practices have one of the most significant impacts on the food safety systems in a retail establishment. During each NEARS assessment, questions are asked about the establishment's glove policy and written policies, along with visual observations made to review hand hygiene and food handling. All the implicated establishments indicated that their establishment had a glove policy, but only 4 of the establishments had a written policy. Hand washing observations take place during the NEARS assessment to determine if food workers are washing their hands when appropriate and for the correct amount of time. This slide illustrates that during 45% of the assessments, food workers were not washing their hands when necessary, nor for the proper amount of time, which is a 21 percentage point decrease in the observations of improper hand washing from 2023. While improvement was noted in this year's observations, hand washing remains an area of importance and concern in the prevention of foodborne outbreaks. In addition to hand hygiene, food handling practices are visually observed during the assessments. Food handling practices can be performed a variety of ways with both ready-to-eat and non-ready-to-eat foods, such as with gloves, without gloves, or bare hand contact, or with utensils and other food handling practices. During an assessment, sanitarians record all the different types of handling that are observed. Since sanitarians can observe more than one type of food handling practice, multiple different practices may be recorded for each assessment. In this slide, ready-to-eat foods are abbreviated as RTE. Gloved hands touching ready-to-eat foods was the most common type of food handling observed during assessments. Gloved hands touching non-ready-to-eat foods and other methods to prevent bare hand contact tied for second for the most common type of food handling observed. Next, Wahaj will discuss data on employee health policies and reportable symptoms.
Thank you, Jenna. Written and verbal employee health policies are discussed and reviewed during a NEARS assessment of the 11 establishments implicated in an outbreak. 2 did not have an employee health policy and 1 was unsure. Of the 8 establishments which stated they had an employee health policy, only 5 of those policies were written. The graph on the chart indicates the reportable symptoms of those 5 establishments indicated as reportable by their employees. All 5 establishments indicated that vomiting and diarrhea were reportable symptoms. Only 3 of the establishments require reporting of jaundice and sore throat with fever, and just 1 required reporting of a lesion with pus. The NEARS instrument asks whether managers inquire about which symptoms employees are experiencing when they call in sick, rather than just relying on the employee to state their symptoms. 63.6% of the managers interviewed do ask what symptoms are being experienced. As part of reviewing the establishment employee health policies, each establishment is asked if there is a policy on restricting or excluding ill employees. 10 of the 11 establishments indicated that they did have a restriction and exclusion policy, 3 of which were written policies. The NEARS instrument also asks about sick leave availability for both managers and food employees. Last year, 63% of the establishments offered paid sick leave to their managers, but only 45% of establishments provided paid sick leave to their food workers. One of the managers was unsure about sick leave provided at their establishment. The percentages of establishments that have offered sick leave for both managers and food workers have increased compared to 2023, showing 5 and 12 percentage point increase respectively. In 2024, 45% of food facilities where an outbreak occurred did not offer sick leave to food workers. and of those facilities that did not offer sick leave, 50% of outbreak were norovirus. On this slide, the first number below each agent shows number of outbreaks where employers offered sick leave. Second number shows number of outbreaks where employers did not offer sick leave. And the third number indicates the manager was unsure about sick leave offering. Outbreak caused by norovirus in 2024 showed that 3 of the establishment offered sick leave, 3 did not offer sick leave, and 1 establishment was unsure if sick leave was offered. The close of investigation, the NEARS assessment, the foodborne illness investigation team uses the investigation, epidemiologic, and lab information to determine the contributing factor of an outbreak. Contributing factor are the preventable cause of outbreaks, such as food preparation practices, behaviors, and environmental conditions that lead to an outbreak occurring. Contributing factors are separated into 3 types of factors: contamination, proliferation or growth, and survival. There can be more than one contributing factor to an outbreak. Thus, the number of contributing factors will not equal the number of outbreaks that occurred. When determining contributing factors in an environmental assessment, the entire investigation team, from epidemiologists to communicable disease nurse, the laboratory specialist, and sanitarian, should contribute to the conversation. Next, Sarah will discuss contributing factor determined in 2024 and information about some of the outbreaks.
Thank you, Wahaj. Contamination factors were the most common type of contributing factor in 2024 and cited in 8 of the 11 outbreaks. Proliferation and survival factors were cited in 2 of the outbreaks. In 2024, C10, contamination through infectious food worker or handler through gloved contact with food, was the most common contributing factor, being cited in 4 of the 11 outbreaks. Contamination from an infectious food worker or handler is a common contributing factor for norovirus. The graph on the slide illustrates the different contributing factors identified in 2024. Contamination from infectious food worker or handler through unknown hand contact with food or indirect contact with food, or C11, tied for the second most contributing factor in 2024, with 2 other contributing factors, C7, food contaminated by an animal or environmental source before arriving at point of final preparation, pre or post-harvest, and S1, inadequate time and temperature control during initial cooking/thermal processing of food. All of the outbreaks that listed C9, C10, and C11 as contributing factors were norovirus outbreaks, which indicates that stressing employee health and hand hygiene and prevention of norovirus outbreaks is critical to food protection. Both outbreaks that cited survival factors, S1 and S2, were outbreaks caused by Salmonella enteritidis. 2 outbreaks were listed with undetermined contributing factors, as there was not enough information to decisively state what caused these outbreaks to occur. Outbreak investigations that include clinical sampling, thorough interview data, and an environmental assessment that occurs within the first 24 hours of suspecting a facility involved in an outbreak all contribute to the ability to determine contributing factors in an outbreak investigation. For more specific information on the 2024 outbreaks and their determined contributing factors, be sure to check out the full 2024 NEARS report on SharePoint. Contributing factors are the cause of the outbreak, whereas environmental antecedents are why the outbreak happened and determine the root cause of the outbreak. There can be multiple root causes for an outbreak, which is why there are more than 11 environmental antecedents identified. On the slide, the y-axis represents the number of times that the particular antecedent was identified as an environmental antecedent in an outbreak this year. Like 2023, lack of training of employees on specific processes, and lack of food safety culture were tied for the most frequently identified environmental antecedents in 2024. It is noteworthy that lack of training of employees on specific processes was also identified as the most frequent environmental antecedent in 2022, making it a frequent antecedent 3 years in a row. The second most frequently identified antecedent was lack of oversight of employees or enforcement of policies. 3 environmental antecedents shared the spot for the third most noted antecedents, including insufficient staffing, contaminated eggs, and undetermined. Last in line were insufficient process to mitigate the hazard, food not treated as time and temperature controlled for safety, and equipment not used were noted in 1 outbreak each. There were 2 outbreaks where an environmental antecedent could not be determined. If a contributing factor is unable to be determined in an outbreak, then the environmental antecedents are likely to be undetermined. Next, we will move forward to discuss the opportunities for improvement for the NEARS program. One goal for the NEARS program in 2024 was to develop tips for long-term compliance for each foodborne outbreak. Tips for long-term compliance are typically sent in a letter form from the NEARS program to the agent program or operator, depending on the situation for the outbreak. Those letters include suggestions to prevent similar occurrences from happening and leading to an outbreak. Tips for long-term compliance were developed for 1 outbreak in 2024, but the development of these tips was not maintained long-term throughout the year. The approval process can be a long period between the occurrence of the outbreak and approval of the tips, which presents an opportunity to develop a set of templates for focused tips based on the outbreak agent. Having a template to start with would improve response times and rates needed for these tips and could be revised and edited based upon the specific outbreak. The Rapid Response Team Coordinator position changed, which resulted in the need for a new person to train in their role and develop the working system with the NEARS program. Previously, the Rapid Response Team Coordinator entered the NEARS data into the database and managed outbreak event tracking. With the change in this role, the program was behind on data entry and outbreak tracking. As a response, 2 of the 3 advanced sanitarians were trained on using the NEARS database for data entry. The NEARS and RRT coordinator have communicated and are working to improve data event tracking. Next, I'll hand it off to Jenna.
4 quarterly NEARS meetings were held for certified sanitarians to provide continuing education to improve NEARS skills statewide. 2 of the meetings featured presentations from experts in NEARS assessments and sampling from New York and Tennessee, respectively. The connection to these experts were made through conferences and trainings attended prior to the quarterly meeting. The other 2 meetings featured breakout activities to improve data collection to ensure data is consistent and accurate. The NEARS program met its goal of having all Division of Food and Recreational Safety Advanced Sanitarians NEARS certified and certified 2 additional agent sanitarians. The Advanced Sanitarians have also taken on a larger role in the NEARS program, such as entering NEARS data and attending outbreak coordinating calls in the 2024 year. This was the first year that an advanced sanitarian was assigned to perform a NEARS assessment in place of the coordinator, which is a celebration for the NEARS program. To improve data collection and assist agent sanitarians in keeping their investigation skills sharp, the coordinator worked with the Retail and Recreational Program Manager to develop a NEARS assessment evaluation form for evaluating the environmental assessment skills of certified NEARS sanitarians. The form was approved through the document control process. The next step is to develop a process for evaluation. In 2024, the NEARS coordinator jointly presented at the National Integrated Foodborne Illness Response Management Conference on a 2022 Salmonella infantis outbreak with an epidemiologist from the Department of Health Services. The presentation highlighted the joint response, contributing factors, and outcomes of the outbreak investigation. Outbreak information sharing through presentations, such as this one, allows outbreak response professionals across the nation to improve outbreak response and connect to break down silos between jurisdictions. At the Wisconsin Environmental Health Association conference, the NEARS coordinator presented on the relationship between employee health policies, hand washing, and outbreak prevention. As part of that presentation, the coordinator facilitated an interactive session during which attendees were provided real outbreak scenarios to respond to and share with the room. These training sessions seek to improve outbreak response locally and to help sanitarians across the state consider the unique situations that may occur during an outbreak. As 2024 came to an end, the NEARS program saw the growth of the Advanced Sanitarians coming together as a team, focusing on exercise development for Part 4 of the NEARS instrument. In 2025, the program seeks to continue the path of team development, data accuracy, and further the program through the following goals. Begin development of an evaluation process for NEARS certified sanitarians, which utilizes the NEARS evaluation form for certification and maintenance of the NEARS certification. Have each state advanced sanitarian develop and facilitate a NEARS quarterly meeting. Collaborate with the Rapid Response Team Coordinator and Department of Health Services to provide a tabletop exercise to agent programs in 2025. Provide training and review of remaining sections of the NEARS instrument to certified sanitarians to improve data collection. Continue developing points for long-term compliance as part of the after-action recommendations for facilities involved in outbreak investigations, including templates for those letters. Create a succession plan to ensure all aspects of the NEARS program have an additional NEARS team member trained in those aspects. With the implementation of these goals, the program seeks to improve Wisconsin outbreak investigations, utilize the information from these investigations to improve outbreak prevention and food protection, and to improve operation with the inclusion of the state advanced sanitarians in all aspects of the program.
Thank you everyone for your time. Please feel free to direct any questions to the phone number and email on the screen.